Hi everybody! Alright, so this video is an isolated skills demonstration just to show how to operate the monitor in AED mode. So if you arrive on scene of a cardiac arrest and you need to apply the pads and use them correctly, that you can do that. So the first thing you're going to do is turn the monitor on with the green button that's on top. And the speed at which I'm doing these things is not necessarily the speed that you should be doing them at. You should be doing them as quickly as possible, but as efficiently and cleanly as possible. So the monitor's on. Over here is our therapy side. This is the diagnostic side, so we're focused on this side. We keep a set of adult pads pre-connected to our wire, to our therapy cables here all the time, so you shouldn't have to worry about connecting those. If for some reason they aren't pre-connected, then obviously grab a set of the pads that we keep here and go ahead and connect them. We keep an extra pair of adult pads and one set of pediatric pads here on this side. I'm going to pull these pads out. These particular pads have the puck in the middle that's going to give you CPR feedback. This is going to, they're all the different types of pads that we may have, that you may come across, all have pictures that indicate where the pads need to go. So this one's going to go on the patient's right upper chest, and this one's going to go down on the lower left here. This mannequin is slightly undersized for this demonstration, but that's what we have to work with. So you're going to peel the backs of these pads off, and you're going to place them appropriately on the patient. Again, it's slightly oversized for this patient, so there's going to be some overlap, and this puck is probably not going to be exactly where you should have it on an adult patient, but you get the idea. Very sticky expired pads. Alright, this one's going to wrap down around the side here. Be careful not to get your wires stuck underneath. And make sure that if this was an actual patient, that these aren't overlapping at all and that they're adhered firmly to the patient's skin. Prior to applying these, obviously, you need to remove the patient's clothing, make sure they're somewhat dry, and shave them if necessary. Again, not the point of this video, but just as a reminder. Once you have those applied, if the monitor was actually picking up on the electrical activity coming from the patient, it would default to pads mode immediately, but we're going to help it along, and we're going to hit analyze.
Attach pads.
And then it's going to coach you through it. So it would already detect that the pads were on. It's not doing that right now because it's not on an actual person, but it's then going to, once it detects those pads on, it's going to go ahead and analyze. If a shock is indicated by the monitor, then it's going to go ahead and charge the monitor as well. You don't have to do anything for that. And then once it's fully charged, it's going to instruct you to press the shock button to deliver the therapy. So if we were going to do that, I'm clear, you're clear, everybody's clear. Shock. The shock would be delivered, and then of course you would resume CPR and the rest of your therapy and treatment.